So, without further ado, I would love to introduce Brian Ronholm. He's the Director of Food Policy here at CR, and Brian's going to take us through the rest of this event. Take it away, Brian.
Great. Thank you so much, Ellen. And thank you to everyone for joining us today. It's a beautiful day here in the Washington, D.C. area. And if you're not familiar with the climate in the D.C. area, we get spring for about 5 minutes before we go straight to the heat and humidity of summer. So we always appreciate nice days like this. And I'm pleased to moderate this distinguished panel today. And as Ellen indicated, we're going to talk about the safety of drinking water and the harmful contaminants that are in our water. And we're going to be joined in this discussion by our own Dr. James Rogers. He is the Director of Food Safety Research and Testing at Consumer Reports. Also Sydney Evans, who's a science analyst at the Environmental Working Group, EWG. And hitting cleanup is Erik Olson. He is the Senior Strategic Director of Health and Food at the Natural Resources Defense Council, NRDC. So we're going to kick off the discussion today to talk about the report that we worked on that Alan alluded to. It was a recent study that was released last week by us on the safety of water, and we collected samples from across the country and found widespread contamination with PFAS, lead, and arsenic. So we'll start with Jim's team. His team was the one that conducted this analysis. So Jim, why don't you kind of get us started by going through what your team worked on and explain what you found.
Okay, thank you, Brian. So Consumer Reports partnered with The Guardian, and we got a number of volunteers to collect water samples for us. It was from all states in the continental United States. It collected samples from the 10 EPA districts, and we had 12 samples per district, so that's 120 samples. Once these samples were collected, we had trained the sample collectors, our volunteers, to ship the samples to a certified water testing lab to test the samples for PFAS chemicals and for heavy metals. Our PFAS testing tested for 30 different PFAS, and for heavy metals, we looked for arsenic, cadmium, mercury, and lead. And I want to note that we used the same methods that our own Environmental Protection Agency uses to test for PFAS and heavy metals. We then gathered this data and this information and analyzed it to see what we actually found. So if we look at just the PFAS chemicals, 117 out of the 120 samples were positive for PFAS. Greater than 35% of those samples had 2 or more PFAS chemicals in them. Greater than 25% of the samples had 1 PFAS chemical. And all these levels that we found in those 2 categories were above public health limits, those limits of PFAS concentrations in water that are considered safe. And I wanted to note that 2 of the samples exceeded the EPA proposed limits of 70 parts per trillion. And so we had one sample that was 80 parts per trillion and another that was 73 parts per trillion. And those samples were obtained from Pittsburgh, North Carolina, and Alexandria, Virginia, respectively. For heavy metals analysis, every sample that we tested had measurable levels of arsenic. Now, arsenic is a naturally occurring heavy metal that can get in through your water via natural deposits or from industrial or agricultural pollution. The key here is that low levels of arsenic in your water can lead to health risk over the long term. So these are chronic issues for health, including lowered IQs in children and certain types of cancer. Nearly all the samples that we tested were positive for lead. Lead leaches from the service lines that lead into your house, lead pipes that you may have in your house, lead, and fixtures that may contain lead. Exposure to lead is unsafe at any level. So we prefer 0 lead, but obviously we found lead in our samples. And again, lead found in the water over long time is linked to reduced IQ and slow growth in children, high blood pressure issues in adults, and reproductive problems. So what can consumers do? The one thing that you can do is ask your local municipal water provider for the community water reports. These are required to be provided to consumers at least once a year. They examine the water that leaves the facility. And you can usually find these either sent directly to you or find these on the municipal water treatment's website. Next thing you can do, because that only tests the water coming into your house, but not the water coming out of your tap, is to test your own water just like we did. So we recommend that you use a certified testing lab, and the EPA has a website that lists those labs that they consider qualified for testing water. You can also ask your local water utility to test your water for you, and sometimes they'll do this for free or at reduced costs, especially for families with children. And then another consumer group that has looked into contaminated water is Healthy Babies, Bright Futures. And in the past, they have offered reduced cost water testing to consumers. What else can you do? So if you get your water report back from a testing lab and it has some of these chemicals in them, you can get a filter. It's important to match the type of filter to the type of water contamination that you're detecting in your water. They can range from a water pitcher that you put in your refrigerator after you fill it up with tap water, to an under-sink system, to a reverse osmosis filter. You need to make sure that the water filter that you choose not only is matched to the contaminants that you're trying to remove, but also that it is certified to certain standards. And the National Science NSF International and American National Standards Institute are two certifying bodies to say that these filters will be able to do what they say they do. And Consumer Reports itself has tested water filters. And so there is a link available where we've actually tested the water filters, and we will tell you how well they have tested in the ability to remove these contaminants in our hands in our testing laboratories. Brian? Can't hear.
Thank you so much, Jim. I think in the interest of transparency and fairness, we probably should mention, the limitations to this study and the limitations involved in the study. And I think this kind of incorporates some of the questions also that are popping into the chat box and the Q&A box. Can you outline for us, what the limitations were and are on this study? And Ryan from the East Bay, I'm from Hayward, Ryan. All right. Are there any kinds of national testing standards? You mentioned the 30 PFAS chemicals. Ryan's water provider in Oakland tests for 18 PFAS down to a concentration of 1.8 parts per trillion. So just kind of talk through what the limitations are and if you can address Ryan's question.
Okay, well, a couple come to mind. There are over 5,000 different PFAS chemicals that are out there, and there are more being added to the list as manufacturers develop more PFAS chemicals for coatings of cookware or firefighter foam, et cetera. So the fact that we could only test and detect 30 is an obvious limitation, because there are many, many more that are out there, but the tests are just not available yet. The second limitation is obvious. We were only able to collect and test 120 samples, and compared to the millions of consumers out there that get their water from their tap, that is a small representation. We did try to do a statistically designed study where we actually tried to take a sample from each, like I said, EPA district and from different municipal water providers to try to get the best coverage that we could. But again, that it was only 120 samples. The final limitation that comes to mind is that this is a snapshot in time. And so this is one water sample collected one day and shipped to a lab. And while at times you can get fluctuation of the levels of these contaminants in your water if you were to test over time. We believe that the positives are the positives. And so it really does reflect the presence of these chemicals in the water. And if you were to test another day, you may not see them or may not see them at that height, but they're there. And so we trust our results, and we believe that they actually indicate that where we did have positives, they do indicate issues with the water supply going into that household.
Yeah, that's great. And I think that's a good transition to go to Sydney to talk about the work that EWG is doing, because I know, they've done an analysis of PFAS tests across the country and have a very convenient, easy to use interactive map on their website, I believe. Is that right, Sydney? And I'll turn it over to Sydney, kind of, talk through what EWG has been working on and for the past several years on this issue. Go ahead, Sydney. Thank you.
Sure. Thank you so much for having me. So I'm a science analyst with Environmental Working Group, and over the past year or two, I've coordinated the EWG nationwide testing and then specific regional Northern Virginia PFAS testing projects. And I research tap water in general. EWG started working on PFAS contamination a long time ago, all the way back in 2000, when the first phase out of the PFAS, so which the ingredient in Scotchgard, was starting to happen. And EWG's worked for the past 2 decades to bring national attention to the use and pollution from PFAS. So I was really, really pleased to be able to talk on this webinar to see Consumer Reports report that they did, because when we did our nationwide testing, we were limited to just 40 samples across the nation. It was, where we had volunteers or where our staff were able to get to. And so to see this report come out with more samples, more locations was, I don't know if exciting is the right word because of the nature of the study, but it was good to see that it was moving forward. It was interesting to me because in the handful of places where our testing and Consumer Reports testing overlapped, we saw consistent results in those handful of places. So as James was saying, there's a possible fluctuations over time. It may not be exactly the same, but what we are seeing in those handful of cases is that the contamination is not going away. It's still sticking around. It's still there. I think the samples were mostly a year apart. And it's this report that Consumer Reports has done is filling in those gaps because there isn't any nationwide monitoring requirement for PFAS. So it's hard to say, when people ask us, well, what do I do? How do I find out if this is in my water? There are some resources out there like our testing, the PFAS map that we publish, but to know for sure, it's really hard to say. So this work is really important. We ran similar tests. So it was through a certified laboratory testing for about 30 different PFAS compounds. And we had the same kind of range of results. Most of our test results had some level of PFAS. I think it was all but one in the nationwide testing, and with a handful over that 70 parts per trillion level, and most above, what EWG supports as the health-based guideline. And it really backs up, the work that we're trying to do. And while it's still a little bit frustrating that we're still trying to call attention and still trying to get more testing on this issue, it's really good to see it moving forward.
Great, thanks, Sydney. Before we move to Erik, just a question for you and Jim, just in terms of the science aspect of this and the testing. And I want to incorporate, a question from Alex in the question box. Does technology exist right now to filter this out and get us to a more acceptable level? And is it as simple as these municipal water systems adding PFAS filters? How costly are they? And is there off-the-shelf convenient technology that can make a big dent into this problem? Do you have any thoughts on that?
To answer the filter question, yes. Many facilities, and we did a story on a bottled water company that was able to filter out using reverse osmosis filters, PFAS. I think the issue with the municipal system, however, that you're talking about huge volumes of water that they have to provide to consumers per day. So that would seem to be more difficult for, like let's say a municipal water provider for New York City to be able to filter out the PFAS from such a large amount. There is a technology, but I'm not sure that it's at scale that every municipal water facility could afford it and install it and use it. I don't know if Sydney has a different perspective on that or not.
Yeah, so for the individual, there is some evidence that home-based filters certain technologies can filter out PFAS contaminants or reduce them at least. So there is that for the meantime, although EWG doesn't believe that the burden of safe water should be on the consumer. It's an option that people have right now, and that's good to have. But it really does need to be community level solutions, and that gets you into the the utility monitoring, treating, testing, and there are a few aspects worth flagging for people, which is the types of filtration technologies used at the community level are not commonly implemented. They're not regularly used for the other regulated contaminants. So it's something that would be additional. And then of course you get into the issue with a cost, cost of water, cost of treatment, which, it's the utility's responsibility to provide safe drinking water, but they're not at fault for this contamination. This is a completely man-made contaminant that is in our water due to, discharge, mismanagement, industrial use. So it really comes back to the polluters who should be responsible for that cost, at least from EWG's perspective. And then on top of that, regardless of whether it's at home or at the utility level, that treatment does not destroy PFAS. It is incredibly hard to destroy these compounds. They don't break down naturally, which is why they're such a big problem. So you end up getting into this waste cycle. So where does that activated carbon go? Where does that reverse osmosis water concentrate go? And unfortunately, the answer is usually back into the cycle, back into the environment through a number of different pathways.
Right, just one quick follow-up I want to incorporate before we get to Erik, and that is, the so-called EPA guidance is 70 parts per trillion. EWG's recommended level is 1 part per trillion. There are some others that call for levels that are kind of around that range, either 1 through 5. Why? First of all, how did EWG come to that figure, and why do you think there's such a disparity between what EPA considers to be a safe level and what most consumer groups would feel would be a safe level?
Sure. So that high level was set for primarily just 2 compounds a while ago. And EWG just doesn't believe it was based on the latest research. And there is a balancing act there when you look at the regulations and the government set guidelines. Typically, there's this consideration for cost and testing for everything else, whereas EWG solely focuses on health impacts. We look at levels that are specifically protective of all people, even sensitive populations. And so that 1 part per trillion guideline actually comes from outside academic research. It wasn't EWG that saw that there were impacts to children's immune functioning, which we would consider one of those sensitive populations. And the levels at which those impacts were seen suggest a safe guideline to protect those people and those children of 1 part per trillion. So it's based on the latest research.
Gotcha. Thank you, Sydney. And I want to bring in Erik. So we now have a sense of the problem that we're facing and the depth of it, and how can we get to some solutions? And a lot of folks are pointing to legislation and the Hill, and this is where Erik will have a good beat on things. You all may know that there's a saying in Washington where success has many parents, and whenever there's a major legislative victory, there's a lot of people who like to rush in and claim credit. And that was certainly true with the Food Safety Modernization Act back in 2010, FSMA. And once that passed, there were many people who rushed to kind of take credit for it. But there's only a handful of folks who really were instrumental in getting that bill enacted. And one of those folks was Erik Olson. In his former role. So he's tuned into the kind of the legislative process and finding these legislative and regulatory solutions. So Erik, can you kind of talk through so some of the pending proposals that we're hearing about. I mean, clearly, the Dingle bill is a primary bill that we hear about. It passed the House last year, likely to do so again. I think it's going to get reintroduced next week. There's the infrastructure package that the Biden administration has released that points to this issue, and there's some other bills too. Can you just kind of walk us through some of these big proposals? What are some of the overlap, and what can really be effective in tackling this issue?
Well, thanks a lot, Brian, and thanks for Consumer Reports for hosting this. I think that we have to keep in mind that PFAS is emblematic of just a really widespread problem. PFAS are extremely toxic at extremely low doses. We're talking about parts per trillion. As you just heard from Kimberly and from others, we've heard that levels in the low parts per trillion are toxic. And that's just very unusual for many toxic chemicals. They also are highly persistent and highly mobile. So a legislative solution really needs to deal with all of these problems at the same time. So the most comprehensive bill, as you just mentioned, really is the PFAS Action Act, which we expect to be reintroduced by Congresswoman Debbie Dingell next week. That bill passed the House last year, and it died in the Senate graveyard last year. We are hopeful that maybe this year it'll be a little bit different. The bill is pretty comprehensive. It doesn't do everything that needs to be done, but it would require standards to be set for drinking water that would be protective of vulnerable populations. It would require many other steps, including actions to list some of the PFAS as hazardous substances under the Superfund law, so that we could start cleaning up these thousands of sites that Sydney's maps show across the country. And it would take several other steps to start to turn off the spigot that's spewing out these toxic chemicals all over the country. So the PFAS Action Act is the big kahuna out there that would take a bigger bite out of the problem. There's several smaller bills, some of which are really significant, some of which haven't been introduced yet, but we know are coming. President Biden just a week ago recommended in his infrastructure package a $10 billion investment to deal with PFAS, especially focused on drinking water and on some of the rural water issues that are associated with a lot of water contamination, some of which you talked about, including arsenic that can occur in a lot of rural communities. So that infrastructure package, a version of it has started to move in the Senate. We'll see similar legislation moving in the House. So I think those are two of the bigger items, one being the Dingell PFAS Action Act, and then another being infrastructure legislation. There are several other sort of narrower targeted bills that would address things like cosmetics that contain PFAS, bills that would address things like the use of PFAS in Department of Defense, which has been a huge polluter of PFAS. Other bills to address things like Clean Water Act, discharges into surface waters, and sewage sludge that can often contain PFAS. So there are these smaller bills, but I think what we really need is the kind of comprehensive approach, both on regulating them and on helping to pay to clean them up. And ultimately, it should be the polluters that are paying to clean this stuff up, not you and I and consumers paying. It's the people that are spewing this stuff out into the environment and causing people to get sick that should be paying for it.
Great, thanks a lot, Erik.
Sure.
A question for all of you, and this is very consumer focused, just in terms of ultimately what can consumers do to tackle this issue, whether it's from a science standpoint, getting a filter, how can they advocate, whether it's federal or state legislation, and we can get to kind of state topics as well. But from a strictly consumer standpoint, are there filters that can help with this? Like a lot of folks, I see a lot of questions in the chat and in the Q&A box regarding Brita filters. How effective is that in terms of reducing contaminants in tap water. And I think there was another question about just, with all of these, can we speak to a framework that would address treatment and removal of all emerging contaminants? And Jim, this is a question probably specifically for you, is have we ever tested refrigerator filters and their ability to kind of reduce or eliminate these contaminants? And Erik, maybe you can talk about, how can consumers, how can our respective members make a difference in the legislative battle? Who are the best people to target on some of this legislation, and how we could move forward with that? So I'm sorry, I asked kind of a broad range. So why don't we, Jim, why don't you go ahead and get us started?
On the question on testing of refrigerator filters, to my knowledge, we have not recently tested those. We've focused on the pitcher filters, some under sink filters, and like I mentioned, the reverse osmosis filters. CR may have tested it before and they're not on our website. And if we did, that means it's old data, but I'm not familiar with us testing refrigerator filters, but I will take that back to our filter testing people and see if that is possibly on their upcoming filter testing agenda.
Great.
And Brian, I'll speak a little bit to your question. I will say I have a personal interest in this because I happen to live in Alexandria, Virginia, where the testing shows we're right at the very top of the PFAS contamination. And I happen to have installed a reverse osmosis under the counter filter prior to knowing that. So it makes me doubly happy that we did that. And it is certified, by the way, and it came out well in your testing. So, so in terms of what citizens can do, I used to work in the Senate and have worked on legislation for many decades. And I will say that there's nothing more important to members of Congress than getting handwritten letters or phone calls or direct letters that people with real issues directly contact their member of Congress or their senator. It really does make a difference if people reach out to their elected representatives and say they want action on something like, we've been talking mostly about PFAS. We didn't talk much about lead, but this is another big issue that President Biden recommended a $45 billion investment in fixing our lead crisis. We all know about Flint. Most people don't know that in all 50 states, we have lead contamination of drinking water. Your testing confirms this. And we do know that we've got about 6 to 10 million households with lead pipes going from the street into their house that need to be pulled out. And President Biden has just made a recommendation that Congress fund that. That's going to be a big piece of the legislation moving too. So I think residents talking to their elected representatives saying, let's deal with PFAS, let's deal with our lead contamination problems, and let's upgrade our water systems. We're still living off of water systems, in many cases that were built around World War I or even before that. A lot of the pipes are 100 years old. And the treatment technology is, as has been mentioned, generally does not remove things like PFAS. So we need to upgrade those. We should be a shining city on the hill with good, high quality water infrastructure and treatment. It's not up to the task, and we need to make those investments.
Sydney, do you have anything you wanted to add?
Sure, I've seen a couple of interesting things in the chat too. I'll go ahead and call out right now that EWG doesn't do any water filter testing ourselves, but we do have a water filter guide that kind of goes over the explainers for how the different technology works and what might work and not work for different contaminants. And it goes back to the drawbacks of each of those types of technologies, not brand specifically, just the types of filters. And I did see something I wanted to address as well, which is, where did PFAS come from? Sorry, we haven't addressed that yet. There are a lot of different sources, and one of the big ones is, of course, industrial and manufacturing use of these compounds for non-stick, waterproof, grease-proof type coatings. And because they're so useful in that way, they're widely used in everything. I mean, you get fast food wrappers, you get outdoor equipment, as well as all of the industrial uses. So I just wanted to clarify that for anyone who was curious.
And that's a good point, Sydney. And I think, I'm sorry, Eric, did you want to kind of jump in here?
Well, I just wanted to say that also we're not talking so much about what EPA could do. I noticed it was posted in the chat that Consumer Reports has a terrific petition, but this is something that EPA could be acting on as well. They have authority now. They don't have to wait for legislation to do things like crack down on lead contamination. They've just announced they're reviewing the Trump administration's lead rule for lead in drinking water, and they're going to be holding roundtables all over the country. So people can and should weigh in with EPA and say that they'd like EPA to take action on PFAS and on lead and to protect our drinking water and protect our environment from these toxic chemicals. That's very important as well.
I think that's an excellent point, Eric. And I'm wondering, do you think that EPA, certainly in the previous administration, there was very little will to move forward on anything like this. And we did see an announcement from the Biden administration's EPA early on that their intent to focus on that. But of course, as we know, announcing your intent to focus on it is different than actually working on it. And is it your sense that maybe EPA is kind of waiting for that congressional push to kind of give that political will to move forward with something? Or is this something that if we apply the political will, the pressure, that it would compel them to act in that way?
Yeah, I used to work at EPA also, as well as in Congress. So I will say that, EPA, it's a political animal. EPA is a political animal. And if there's not pressure coming from Congress and from the president and from the public, honestly, EPA finds it very difficult to do anything because they're getting pressure from industry. So it's really critical that EPA hear from Congress and hear from the public about the need to take swift action. I do think there's some excellent appointees that have come into EPA. The new EPA administrator, Regan, is from North Carolina, and he dealt with PFAS contamination, which is massive in North Carolina. So there's some, I think, hope that he and the new head of the water office, Radhika Fox, will really try to tackle this issue. But they've got political counterpressure coming from very powerful industry and political interests. And I think it's got to be a combination of insisting that EPA do its job, putting pressure on Congress to move. And I think it's a dance in Washington between Congress and the administration. You need everybody dancing in the same direction. And I don't care who's taking the lead, honestly, on a specific issue. We need to dance in the same direction. And the only way that's going to happen, I think, is if citizens rise up. And that's one reason I think the EWG and the Consumer Reports testing is so important. I've seen mention of this. It's so important to get this information out as broadly as possible. If almost everybody has PFAS in our bodies, I think the testing is 99% plus of Americans have PFAS walking around in their bodies. We're not getting rid of this stuff. We're walking around with it. Our kids are born with it in their bodies. We need to take care of this problem, and citizens really need to rise up and say, we've had enough of this nonsense. Let's get this taken care of, Congress and EPA.
And it seems like another potential pressure point is at the state level. We've seen a lot of state legislative bodies work on bills. Obviously, the schedules are staggered throughout the country. Some have brief sessions, some are year round. And you're beginning to see more and more bills kind of moving through state legislatures. Certainly this year, Connecticut, Vermont, there's activity. There was a bill in my home state of Maryland that didn't quite make it because of industry opposition. But there's also activity in Minnesota, California. So there seem to be some opportunities at the state level that consumers can also focus on to kind of do kind of a parallel track. Do you think something like that would be equally effective? Because it certainly it's more impactful in the state. There's one question here in the Q&A box about local water bodies, such as the Chesapeake Bay, and how it's present in things like that, where you see, since it's in so many products, and it's manufactured, it seeps into these water. I mean, I don't know if somebody wants to kind of talk through, just how pervasive it is just in kind of state and localities, and how important it is to kind of maybe work at the state level as well to push federal legislation. And I wonder how effective that would be.
Yeah, I'll say one word, and I'm sure Sydney and others will have additional thoughts, but yes, absolutely. Some states are way out ahead of the federal government. For example, you mentioned several in New England. Michigan has done quite a bit on PFAS, and several states, about 10 states, I believe, have some form of standards for PFAS in water, either action levels or enforceable standards. And those are growing, and there's more and more coming. So focused on state level activity is really important, and we can make real progress at that level. But ultimately, you're going to have a 50-state solution to the problem. So I think definitely we want folks to weigh in with their states to move this legislation, which can serve as a model in other states and as a federal model. But we're going to need national solutions to these problems too.
Sydney, any thoughts?
Yeah, I mean, that was pretty much, everything that I wanted to say. And just to draw attention to the fact that, as states set their own regulations and guidelines, which is a fantastic first step, how do we stop that contamination at state lines? If there's, an industry in one state and, a community downstream across the state line is, being impacted by discharges, how do you stop that? And then until we turn off the tap everywhere, I said these compounds, they don't break down, they just continue to spread over time. It's just a matter of time before they get into new areas. PFAS has been detected in the Arctic, I believe, out in the ocean. It's everywhere. It's all across the earth. It's in rainwater. It's insane. So while any steps are a step in the right direction, it is going to take, a big solution to clean up this problem.
That's an important point, Sydney, and it brings me to a question for all of you, and that is, you've all talked about how pervasive this is, how it's in absolutely everything. Erik brought up that 99% of us, it's in our bodies, it's in so many products, and it seeps into the water supply. Are we almost to the point of no return in terms of trying to control this issue, or is it almost too late to do something, or can we still kind of salvage something and get ahead of this through what's going on in the states, what's going on at the federal level? Even in the states, sometimes, there was an effort in Washington State to move forward with something, and it wasn't quite strong enough, and we tried to kind of push forward and make something like that stronger to get ahead of the issue. So just want to get a sense, especially from a science perspective, are we still at a point, can we still control it?
Well, I'm an optimist, Brian, and I think that we have to start somewhere. I think from a testing perspective, we scientists would love to, number one, know what are the new PFAS chemicals that are coming out. Because as I mentioned, there are 5,000 of them at least, and more every day. We don't have standards to even test for the newer ones. So one of the things we would love to see as testers is that if a manufacturer makes a new PFAS, that they provide standards to testing labs to the EPA, so they could then test for the new ones also, and test for the other 5,000 that are already out there. That would really help us monitor and detect, because we're only seeing a small window of what we believe is out there. If we're only testing for 30 and there's 4,900 and whatever left, we're missing a lot. And so it may be even worse than we know presently, just based on not being able to detect accurately and quantitatively what's out there already.
Sydney, any thoughts on that? Is there hope? Are you as optimistic?
Yeah, I mean, doing the work I do, it can be emotional and it can be taxing, but both personally and professionally, I always tell people it is never too late to take action, ever. It It can unfortunately get worse, and we don't want that to happen. And it can definitely get better. Even if, you find out you've been living in an area, you've had PFAS exposure, other contaminant exposure, taking action to protect yourself is always going to be beneficial. And I don't want people to think that there is no hope or that it's too late, because we can do a lot. It's just going to take a big effort.
Yeah, and I would, if I could just weigh in, I think
Yeah.
I would agree. And I think there are examples where we actually have started to see things turning around. We're starting to see more and more companies, for example, phasing out of PFAS in their products. So just as one example, IKEA has phased out all PFAS from all their products. And there are a lot of other companies that are now moving in that direction. So I think with consumer pressure, companies are starting to wake up to why this is a problem. They're starting to look for alternatives. And I think eventually, I really do have hope that the problem is starting to become such a national issue that I think there will be a real effort to move ahead. It's not going to happen by itself without consumers really insisting on it. But I would agree with Sydney and with Jim that we can make a difference. And it's definitely not time to throw in the towel.
No, absolutely. And just a quick response to a question that I got about the Maryland bill. That was SB 195 was the bill number in Maryland that failed. It was a PFAS related bill, and that will fail because of some opposition in the industry. I think there's a manufacturing facility outside of Baltimore, if I'm not mistaken. I believe that was some information that we received. And just kind of, there's a good question too about, eliminating PFAS as a byproduct, and if there are any examples at the forefront that provides, some guidance for us. Are there countries that are working on this that are doing maybe a more effective job in eliminating, reducing PFAS and other contaminants? And I'm wondering if either of you have any examples or know of any other situations that provide a good example of how to deal with this issue effectively. And it might even be at the state level. I know that New Jersey has a level, I believe it's not as low as maybe some groups would like, but I think it's fairly low, if I'm not mistaken. Is that an example? Is that, is something like that going to be a floor as the federal process works out? So just be curious to get your thoughts on that. And somebody notes it's 14 parts per trillion in New Jersey, or 13. So it's somewhere below 20. Is a level like that, is some, Eric, to your point, is something like that going to be more politically feasible in the big picture than say something that tries to go down to less than 5?
Yeah, I mean, so we've been supporting a very low part per trillion number, around 2 parts per trillion for most PFAS. I know EWG is at 1. We'd love to see it get down to 0. But right now, our recommendations are based on what labs can reliably quantitate, and average labs are down around 2. So that's what our recommendations generally are based on. There are a few state standards. Michigan has some that are below 10, although some of their numbers are bizarrely really high. So, if you cobble together a list of the state standards, you'd see several examples where they're in the 5 to 20. Some states have combined standards for multiple PFAS. Some of the New England states, I believe Massachusetts and Vermont, for several PFAS, a combined standard, which is the direction we really need to go in. As I think James has repeatedly said, we've got thousands of these things and we can't regulate them one by one. It's just, if you start going down that path, it'll be literally millennia before we can regulate we think there may be as many as 9,000 PFAS now. You just can't regulate them one by one. So you have to regulate them as a class. And there have been several major scientific papers recently that have been published that say, we've got to stop thinking about these one by one. We've got to talk about them as a class and regulate them as such. And there are technologies to clean drinking water that will take that whole class out of the water. The problem, as Sydney mentioned, is that stuff doesn't disappear, right? I mean, it ends up either adsorbing onto carbon or being a reject water from a reverse osmosis filter. You've got to figure out, we have to figure out a way to actually destroy PFAS. We don't have a good technology to do that now. And that's really something that has to happen. And I would agree with the chat comments that we really need to move in the direction of phasing out these chemicals from manufacture entirely. None of the legislation so far really goes quite that far. It starts getting up to the edge of that, like stopping new uses or stopping new ones from being made, those kinds of things. But we need to go in the opposite direction. We need to phase this stuff out.
No,
I'd
that's
like
right.
to add on to that, if that's okay.
Yeah, of course, Sydney, go ahead.
Yeah, so he brings up a really good point of the difference between just treating this stuff as we find it and turning off the tap. So if we can stop the uses where it's just really not necessary, or stop all uses, which would be great, slowly those levels will decline over time as treatment cleans up what exists in the environment, and that benefits everyone. If we focus just on regulating drinking water and drinking water treatment, you ultimately increase the disparity that exists between systems that can afford that treatment and systems that can't. It's important to remember that just because a regulation gets set doesn't mean a community, especially a small one with a small water system with limited resources, is actually able to do anything about it. They just end up in violation, which of course makes the problem worse. So treating it at the source and getting rid of these uses of PFAS where it's just really not necessary, I think is going to be the main action we need to take.
Yeah, I think that's an excellent point, because otherwise we're always going to be dealing with this issue. We're never going to get on top of it. We're never going to be able to address it. And that gets to Erik's point too about, treating them as individual instead of a whole class. We may run the risk if certain states, or even at the federal level, if we just address one or two items, it gives the appearance of having done something when really we haven't, because the whole class hasn't been addressed, and we're still going to be chasing this issue, if you will. And I think we're at a point now where we need to kind of wrap things up, and I'm hoping that we got to as many questions as we can. We need I don't know if there was anything else. The chat went away, but please feel free to contact any one of us if there was a question that we weren't able to address during the time here. And I don't know if just, we have a couple minutes. I don't know if there's any final thoughts that you all want to convey to our audience, or talk about any upcoming work. And then we can go ahead and wrap up.
Well, I think one thing you asked, Brian, is we continue to say, what can consumers do? And I think what came clear is that education, information, doing research, and then supporting the efforts to remove PFAS. For instance, in the Q&A, it talked about bottled water as an alternative. And as we know from our testing the CR, bottled water can have its own issues too. So I would just urge consumers to keep an eye on this issue, reach out, look into the news, look into the data, and just continue to be informed about the problems that we're seeing with tap water, drinking water.
Yeah, if I could add just two quick things. One is there are a lot of questions about PFAS-free products and whether they're alternatives. And I put in the chat, but it may have disappeared, that a group called Green Science Policy Institute, if you Google them, they have a list of PFAS-free products that you can look for. The second point is, please, folks, weigh in with your elected representatives and with EPA and the administration to urge action on PFAS and on lead, because we really do need to hear the voices of people to move policy.
Sydney?
Yeah, and so I want to say thank you again for inviting me, and I'm so pleased to see the level of engagement in the chat. It was really hard for me to just sit and pay attention to our conversation and not just start typing away and answering people, but EWG actually has a really good landing page for all of our PFAS work, and quite a few of the questions I saw pass by are answered in some of our articles, so I would encourage people to check that out.
Great. Thank you, Sydney. Thank you, Erik. Thank you, James, for being with us and participating in this panel. I hope it was informative to everyone out there. There's so many resources that we have available at each of our organizations. So I would encourage you to check it all out. Just confirming and following on Erik's point, please go to our petition and sign on. It really does matter. I used to work at an agency as well. Both Erik and I are both hill creatures and agency creatures, so we know what works and things like this work. So make sure you get your voices heard and be active. So with that, we will conclude. Thank you so much again, and I'll throw it back to Alan for a little housekeeping.
I think we mostly covered it. Thank you all so much for being here. I just want to call out the email address that's on your screen right now, which is community@cr.consumer.org. That's where you should send us all of the state work that you're doing, all of the things. If you'd like to be involved in something in your state, we'll try to do our due diligence in connecting those dots. Also, you should see here, but we will be sending everything that you've seen and heard from today, all these resources around to you in one, hopefully easily consumable digest. Though there was so much stuff here that it might take you a while to unpack. We hope you will. And just a call out that the petition that we've already mentioned multiple times here is a great starting point, but as Erik called out directly, a handwritten letter, a call to your senator or congressperson or even state senator or state congressperson's office does a whole lot of really good work. And we will do our best to arm you with the sort of current events in terms of federal legislation, statewide legislation that you can call and support, because there is actually some really green shoots out there in terms of what's moving, and we want to support it when we can. With that said, that is really right up to our time. So thank you all for being here. Really appreciate all the wonderful questions, and look forward to continuing the conversation. And do hit us up if you've got some stuff that you'd like help on the state level that we can support from where we are.